Okay, so we're going to try this again. Thanks for joining. Hopefully you will hear this now. If you guys are having any difficulties, please let us know. Um, if you checked in earlier and you did hear some of it, our conversation today is about brain health, specifically about Dihexa, a neuropeptide that is actually being utilized in clinical practice now, and we're really excited about it. For people that either are trying to prevent Alzheimer's disease or that have Alzheimer's disease or other neurodegenerative diseases, or for those that have had traumatic brain injuries, post-concussion syndrome, even after for those people suffering from post-COVID syndrome or other causes of mental or brain fog. So we have I have used it personally in my practice successfully for both traumatic brain injuries. I had a young lady that was hit with an air conditioner and had a severe concussion and neck injury and was used Dihexa after a year of rehab. And that was what gave her most of her cognitive function back. And she's actually thriving now. So I've seen it work for various modalities. So we're really excited about having it. And so just to recap a little bit, what we're really looking at is how can we work on the brain effectively when we don't have any pharmaceutical options for neurodegenerative disease and even mental illness. There are drugs out there that can help slow the progression of the disease that don't work very well. And then, of course, there's mental illness and a lot of pharmaceuticals for both anxiety, depression, obsessive compulsive disorder. But again, there's no cures. So that really leaves it up to us to figure out how we can beat these diseases of the brain or at least improve them. And again, you're going to hear me all the time talk about the importance of lifestyle. But I did want to touch specifically and talk a little bit about brain-derived neurotropic factor, which you're going to hear me talk about a lot, and then talk about this drug therapy called Dihexa, which is a neuropeptide. So again, our brains rely on brain-derived neurotropic factor to create and regenerate nerve cells, nerve pathways, and the transmission of neurotransmitters across these nerve cells, which are called synapses. And so when you hear about synaptogenesis or synaptic progress or progression, that is what we're talking about. And so in diseases of the brain, they have found that across the board, these diseases, they have lower amounts of brain-derived neurotropic factor, which is the protein that actually creates this ability for our brains to heal, regenerate, and function at a higher level. And so when you look at these diseases that all have lower levels of brain-derived neurotropic factor, that's exactly what we're trying to target when we're looking at beating disease, treating disease, obviously, and preventing it. And so there are a lot of things that increase brain-derived neurotropic factor, and specifically, hold on one second, got a question. So Liz is asking about Trim Superburn. Yes, you can take Superburn long term. I've been taking it for pretty much since I created it. So yes, you can take long super burn. It's a great thing that goes along with intermittent fasting. So that's one of the things as we talk about brain-derived neurotropic factors. So it's a good time to ask that question, is that intermittent fasting, high intensity interval training, deep stages of sleep, certain foods, certain supplements like curcumin and omega-3 fatty acids, resveratrol. These are things that increase brain-derived neurotropic factor. That's why you can see people that have a healthy lifestyle have a lower risk of generating either mental illness or neurodegenerative disease. So anything that we can do to increase brain-derived neurotropic factor is going to improve brain health. And so when we look at and talk about Dihexa, Dihexa was doing their research. It started at Washington State University. They started looking at this peptide in 1992 and have since discovered that they believe that Dihexa, and because of the growth factors that it affects, can actually be, they say 10 million times, but they say extremely more powerful than brain-derived neurotropic factor. That's why they're so excited and why we are seeing results in people that are having mental slowness, brain fog, memory loss from various conditions or illnesses, and they're seeing improvement very quickly while using this peptide. And so I guess we're still having technical difficulties, but I'm just going to keep talking. And so if you can't hear, we're going to have this taped, and so you should be able to listen to it at a later time. So Dihexa is available already, and we are excited because it can come in both 5 milligrams and in 10 milligram doses. 5 milligrams seems to be a good starting point for people, and that's 5 milligrams a day. Obviously, I would give it probably 30 to 60 days to see if there's some improvements in cognitive function, and then you could always increase it to 10 milligrams. But very safe. They haven't found any drug interactions at this point. So we're really excited about this because just like other therapies that we do, I perform ketamine in my office for very similar reasons, for increasing brain-derived neurotropic factor and improving the outcome and preventing disease of the brain. So, again, it all starts with lifestyle. I can't stress that enough. So if anybody is trying to beat depression, beat anxiety, or if you have a family history of Alzheimer's disease or dementia specifically, then these are things that you have to pay attention to. Start with just the things that are free, improving your quality of sleep, getting out and exercising 3 days a week, specifically trying to do interval training or circuit training, because these are types of exercise that has been shown scientifically to improve that brain-derived neurotropic factor. So start with lifestyle. And then if you're looking for something else, because if you've suffered from concussions, or if you've had a traumatic brain injury, or if you just have some brain fog and you're just looking to enhance your brain function, give Dihexa a try. You can find some more information on our website, telewellnessmd.com. And again, sorry about the technical difficulties, but we're going to look into that. Again, this will be live or be available for you guys to look at on the website. So if you have any questions, again, for next week, please send us any questions you guys might have. Start making little changes. Every time you make a little change, you feel lighter, you feel better, and that's going to lead to bigger changes. And so just don't think that one slight change in your lifestyle is not going to make a difference, because it will. And the end result is happiness, good brain health, and obviously preventing disease. And I love the saying that when people talk about investing in themselves, a lot of people spend a lot of money on various things in their lives, but a lot of times they don't spend enough money on their own health. And that's why I always say that if people think wellness is expensive, try illness. And I can tell you that illness costs a lot more. So got a quick question here. Okay, Nancy, you just answered my question. Have you seen a positive result in the use of Dihexa in post-concussive syndrome? Yes, absolutely. Like I said, you might have missed it because of technical difficulties, but I worked for about 3 years with a girl that was on disability because she got hit in the head with a air conditioner that fell on her. She had a severe concussion and neck injury. We worked with her doing all sorts of different lifestyle changes, and she was seeing drastic improvements just with lifestyle changes and some of the other therapies that we were doing for her. But it wasn't until she started on Dihexa that she saw a huge change in her memory and cognition, that she was able to go back to work and actually pretty much functioning back to herself. And this is a young girl that was in her early 30s. And so again, we've also seen it for someone that had a traumatic brain injury from doing an Iron Woman contest. Same thing, fell off her bike, hit her head. She was a pediatrician, didn't think that she was going to be able to work again. But between Dihexa and some other hormonal therapies, she was able to get back into work, but more importantly, back into life and having a quality of life. So, so this is a really powerful opportunity for people, especially if you're worried about, family histories. This is just a really nice opportunity for you to see some quick results. I always tell people with peptides, give 90 days. So just kind of commit to a 90-day trial to see if there's a difference. Don't give it just 30 days, because sometimes it takes 30 days for you really to start seeing, getting a balance of the neurotransmitters and some change in the brain. So, yes, you're welcome, Nancy. That was great. So again, if you guys have any other questions for next week, I love talking about brain health just because there are no cures and there really are no solutions. And so this is where we really have to understand, the more aggressive you are in your lifestyle, the better you're going to feel both mentally and physically. So thanks again. Everyone have a great day, and we will see you next week.